keep these two muted.
Okay. But I'm hearing that. I just.
There you go.
Okay. Yeah. So now it's
So
being
now we know
recorded
you're-
here.
Yeah.
But then I can use this because now I'm
Yeah.
connected to.
So now if you use this,
Uh-huh.
I mean, we just tested it out because we heard ourselves.
Uh-huh.
But we. Check.
But if I just mute this, it's just muting the sound, but
It's just
still
muted to
capturing.
speak, yeah. But
Okay.
the people who are joining from will be able to hear.
Okay, cool. At least I can monitor the chat.
The last time I think it was, I don't know who it was, but they forgot to mute.
Uh-huh.
And then you could hear like background noise.
Oh
a
no.
lot.
I'm hoping that's not gonna happen
And
now,
then it
right?
seeps in a little bit. So I think there's an option. So it's like whenever, I know it's on Zoom. I don't know if it's on Teams, but if someone joins, it automatically mutes them. So that way, like some people like forget
I think it's on Zoom.
it's on Zoom.
I used to use Zoom a lot
Yeah,
in my other university.
Yeah.
I don't know. It says Dr. Hernandez's presentation. Join it? So can Devinder see this one?
No. So let's see.
Because this one's not being recorded. Might be on there's two links on the calendar invite. OME put two of them on there. So you should go to the other one.
Gotcha. The one that we were originally.
The one that we're on.
I have a better screen now. A few people on here.
Good afternoon, everyone. Can you hear me? Let me know if you can hear me via the chat. We have a different setup today in terms of our hardware because the lecterns do not have SPSS. These PCs have everything else, but they don't have SPSS. Great. Thanks for letting me know, Priyanka. And so I'll be using SPSS that's available on my laptop. And I'll be using my laptop and the Teams viewer from my laptop. So that's why it's going to be a little bit different for me, not necessarily for you. So I'll be sharing my screen from my laptop for both the PowerPoint presentation as well as jumping back and forth to the SPSS program. So if you're in virtual land or if you're in person, just go ahead and click onto the link for today's meeting. And then you'll be able to see what I'm showing on my screen. But if you're in person, you'll see it on the LCD screens. So welcome. And especially for those of you who haven't had a chance to do some of your own data analysis, whether it's in medical education or other types of research. And we'll focus on the standpoint of really getting into SPSS, some of its functionality. Luckily, this is not a 3-hour lecture or a 2-hour lecture. It's actually workshopped out in a way that I could demonstrate some of the functionality of SPSS and how to use some of the data techniques for very common data analysis techniques. And I'll be using a stepwise approach in terms of some of the I guess, the consultations that a lot of biostatisticians and data analysts use. We'll use a stepwise approach in terms of a 3-pronged system. And it's not a very complicated system, but I'll note it on our PowerPoint here of what that will look like. So if you just bear with me, I'm going to go ahead and start sharing my screen here. And the first set of slides that you'll notice that I'll be using is a PowerPoint specifically for a lot of screenshots in terms of some of the SPSS techniques that we'll be showing. Okay, great. Can you all see the PowerPoint presentation?
Yeah, thank you.
Just bear with us. We're just getting the laptop oriented here on the lectern. So what you'll see here is I'll be bouncing between the PowerPoint presentation and the SPSS program. Now, I will say a word about SPSS. All of our students, as well as our staff and faculty, will have access to download SPSS onto your laptops. It's free of charge. Students pay for it by way of their tuition. So I always tell them, if there's any programming that you need that the university offers, please download it on your laptops because your tuition already prepays for those pieces of software. Same thing with SPSS. It's one of the more popular statistical packages out on the market because it is geared for the health sciences, medical education, and health professions education, and it's very user-friendly. It's actually point and click. There's also abilities to use programming language in SPSS, but if you want to do very quick analyses and you have a very compact data set and it doesn't have thousands of subjects or thousands of participants, it's actually capable of analyzing data with thousands of subjects, thousands of participants, all the way down to maybe very small data sets of under 100 participants. So it has a lot of variety and a lot of flexibility for the size of data sets and its capabilities. So it's very user-friendly for a lot of different purposes. So I'll target this lecture slide deck towards data analysis for medical education research, but every technique here can be used outside of medical education. It can be used for basic science, it can be used for engineering, it can be used for social sciences, etc. So it's not just focusing on medical education, but you can apply these techniques in a variety of sciences. Here's some of our learning objectives for today. And what's nice about how I've set up this slide deck is that I put a lot of screenshots in here so that you'll, once you have access to the slides, you'll be able to refer back to the screenshots to go over the steps on how to access some of these functionalities. But I'll be switching into the live SPSS program so that way you can see how it's functionally accessed for every one of these different techniques. Here's some of our learning objectives for today's little workshop. We're going to look at scholarly activity that involves data collection and data analysis. And when data is collected, it must be analyzed. Otherwise, it's just data in a data set, and it's pretty much useless for us until we start analyzing it. We'll look at the importance of data management and the use of a data dictionary. We'll review SPSS data analysis techniques primarily. We'll look at the stepwise 3-pronged approach of what you should be doing in terms of once you get your hands on a set of data, what's that three-pronged approach? And that leads us to this last objective. That three-pronged approach is perform a univariable, a bivariable, and a multivariable analysis in SPSS. I always tell those individuals that I provide consultations that you don't have to do all of these steps, but you must definitely start with a univariable analysis first, then proceed to a bivariable analysis, and then proceed to a multivariable analysis. You don't necessarily have to go to this multivariable analysis. Sometimes stopping at the bivariable analysis is appropriate. And for some data, maybe stopping at the univariable analysis as an initial stage of analysis, maybe that's appropriate as well. But we always start with a univariable analysis. And for the students in the room, you've probably seen this slide before. I refer to it many times when I give these types of workshops and seminars about data management and data analysis, is that really there are these four reasons why we conduct data management and making sure our data is clean and making sure that our data is readable. Poor data management, where the data is messy, there's a lot of missing values or miscoded data or data that is in one place but should be in another. If it's disorganized, there's missing values or miscoded, it will often lead to unreliable results because you'll be analyzing variables that has mistakes in it, that needs corrections and needs resolutions in terms of fixing those mistakes. And data that is not stable or inaccurate or has mistakes, it can often lead to safety issues, especially if that data is geared towards the health professions. We don't want to produce results from data that has mistakes and that requires corrections because ultimately it might affect patient care and recommendations for how to take care of patients and people that are in need of treatment. Of the four reasons why data management, making sure your data is clean, is corrected, and has the appropriate coding, is one, we want to be able to reproduce our results. If I gave a data set to another individual that is clean and that data set has been corrected and coded appropriately, that individual should be able to reproduce the results I calculated and I analyzed. They should be able to copy and then repeat the same methods on that data to receive the same results. Scientifically, as you can see, we always report and publish our methodology so that other researchers, other scientists can reproduce the same results using similar or the exact same data. Also compliance. There are regulatory bodies as well as journals or publishers that publish results. They require rigorous data management standards to make sure that you're correcting your data, editing your data, coding your data appropriately. So those regulatory bodies and those publishers will want to make sure that your data is pristine, that it is organized and correct. And also efficiency. Clean, organized data saves time. And if you clean your data in the beginning of your data collection process, making sure the data is clean when you save it onto your database, and then cleaned while it's in your database, it becomes more efficient in terms of producing results. It doesn't waste your time to keep going back and forth trying to fix mistakes because you put them off or you didn't do your due diligence and record or correct those mistakes prior to analyzing the data. So in terms of efficiency, it actually helps your efficiency. In terms of our last step, collaboration, this goes along with the first one in terms of the first term in terms of reproducibility. Collaboration, we want to be able to share results. And when we share results with other individuals, what ends up happening is that we create collaborations. People will want to work with us because our data is clean. They see that it's efficient, and they see that the research can be conducted and can be reproducible. So it actually helps us with collaboration because other researchers will want to work with us because they do note that our data is clean. The key takeaway here is data management is not a one-time task. We just don't do it one time in the beginning of our research project. It is an ongoing process that needs to be continued throughout the the research project. And we have to make sure that we keep our data clean, and we have to make sure that we keep making edits to the data, making sure that the data is coded properly throughout the entire process of data collection, data storage, and then ultimately data analysis. So that way we always have these checks and balances. I spent some time on this slide because I want to impress upon the importance of making sure that we all understand we just don't get a data set and assume it's correct. We have to do our due diligence to make sure that it is accurate as well as revised and coded appropriately. All right. In terms of a data dictionary for the students in the room, they got a lot of good examples of what data dictionaries are, because in our research course, our academic research study course, we provide actual publicly available data sets with different types of data dictionaries that accompany those particular data sets. So what is a data dictionary? Really it's a code book, and it contains not only the names of the variables that the data is represented by, but it also contains the different coding schemes and the systems in which variables are coded. They contain the names, the type, the format, allowed values, and a definition or meaning for every one of those variables. On SPSS, what's really nice about this statistical software package is that it actually has a code book or data dictionary screen in which you can identify the name of the particular variables, as you can see here on the left side. It also gives you the type of variable that you can set up to give a description of that variable being numeric, string if it's a text variable that has words rather than numbers, how large the variable is in terms of how many decimal spaces and how large those numbers can be. And as you can see, for text variables that have words, the width of those variables is quite large because you can type words down that require a lot of character spaces to be used. Numeric variables typically are more compact. You have anywhere, depending on the variable, like triglycerides or lipids. Those numbers can be 3 decimal places. Blood pressure, like beats per minute, can be 2 decimal places, maybe 3 if the population is very sick, etc. You can see there's a column here for labels, in which they're descriptive labels that give you an idea of what the numeric designation for the variable might be. There's a textual descriptor here of what that variable represents, and even values. Those values for categorical variables, if it's a 5-point Likert scale, you can see here on the right-hand side, if it's a 5-point Likert scale, all the way from 1 being strongly disagree to 5 being strongly agree. We can set those using SPSS's data dictionary function. And I'll show you this, this data dictionary when we get to the SPSS application component of today's session. As I mentioned earlier, one of our learning objectives today was to look at the data analysis pathway, the three-step or 3-pronged approach to conducting data analysis. We always start with univariable analysis. And as you can tell by the title here, univariable means one variable at a time, because we want to give a picture and a description of the demographics and the sample profile of the people within that data set. It's the very first step, because we want to know who is in this data set. If it's pediatric patients, is it adult patients, or are they elderly senior patients? We want to know who is in this data set by way of their different types of demographic variables, like age, sex, or gender, like education level, whether or not they drive a car or they own their own home. We want to know what the profile of that particular sample is. Moving beyond this univariable analysis, we then can now consider a bivariable analysis. Once we know what all the individual variables look like by way of analyzing how they appear mathematically and statistically, we can then move on to step 2, which is our bivariable analysis, where we can now start comparing variables one against another. And we'll talk about some of the common data analysis techniques and calculations in a bivariable analysis. Once we're done with the bivariable analysis, how one variable compares to another variable, We can get more sophisticated and more elegant by conducting what's called a multivariable analysis, in which we now focus on hypothesis testing. We're looking at our research question and looking at predictive models. We can look at more than 2 variables at a time. Maybe there are 3 variables or 4 variables that we want to look at one time and how they help us predict a particular outcome. What you'll notice about this 3-pronged systematic approach is that it's stepwise. It's a stepwise approach to data analysis. We always start with our univariable analysis first. And sometimes this is enough. And maybe if we are exhaustive in our univariable analysis, we've analyzed all those variables, we can now start comparing variables one versus another. And maybe the bivariable is enough. And once we exhaust our opportunities to make comparisons between 2 variables, we can then move on to the multivariable analysis. You'll notice that we're focusing on starting with our participant profile here with the univariable analysis. Then we have a gradual increase in more complex analysis. Now, I'm not saying that we must do all 3 steps. Sometimes a complex analysis is not appropriate simply because maybe some of the variables do have some limitations. For example, maybe there's a lot of missing values or our sample size is small. We may not have the opportunity to advance our analysis in this step 2 or even this step 3 system. Any questions so far? Looking at the chat, hopefully if you have any questions, please drop them in the chat box and then we'll go ahead and address those. But if you're okay, we'll just continue on with our slides here. Before I switch screens and go right into the SPSS program, I want to first brief you and give you a little preview of what your data might actually look like. Most data, before it even gets into a statistics software program, they'll likely exist in an Excel file or a CSV file. And Excel files, XLSX and CSV files, they roughly look very similar. It's just that a CSV file is not constrained by the program from Excel. It can be converted into an Excel file, but they'll typically have this appearance where you'll have these rows listed here on the left, 1 through infinity, and these columns listed alphabetically using these nomenclatures, A, B, C, etc. And then what will happen is that the way that you should always construct your data is to use this very first row as the labels for your variables. This is customarily accepted in the data analytic profession, where the first row of your data is usually your variable names. And these variable names, for example, for this variable, it's ID, an arbitrary numeric or alphanumeric designation for your participants. And I simply labeled in this data set, ID was the ID of my participants, starting with ID1, ID2, ID3. And again, these are in order numerically, but I didn't assign them to any particular person. They're just random people who completed this survey. You'll note here, I kept it very simple. Column B is Q2, which stands for question 2 on my survey. Q3 is obviously question 3, Q4 text response by Q4 underscore text. You'll see here Q5, Q6, and so on. You'll note that for column A, it's all the IDs starting from the first person all the way down to the last person of my data set. For question 2, you'll notice for that first person, the second person, third person, starting from the top to the bottom, that's how the data will now be arranged, starting from the top of the column, going downwards on the column till the last person is entered. And that will happen for every single column. Every row, for example, here for row 2, that data will reflect person 1 or participant 1's responses. Row 3 will be participant 2's responses. Row 4 will be participant 3's responses, and so on. Hopefully that makes sense. Please construct your data sets in this way because it's universally accepted when you work with a data analyst or a biostatistician or researcher that collects their own data. This is the configuration that their data sets will have. If by chance you have colleagues that didn't get this instruction, there's ways to convert if they reverse this field where each row is a variable and the columns are the participants, we can convert the orientation of the data so it fits this universally accepted norm. Okay, let's keep going if there's no questions. Yes, comment here with Dr. Sandhu. I love the concept of looking at the data file as a code book. It makes so much sense. Yes, and those code books, I fully recommend that when you use code books, and I always harp on this with our students, please write down any changes, not just the corrections and the names or the nomenclature that you're making notes on, not just those elements, but any changes like recodings, new variables that you also create. Make notes in your data dictionary on a Word file and keep that diary. Make it a diary because your research assistants are not going to stay with you forever, although you probably want them to stay with you forever. But sometimes colleagues are working on multiple projects. You're going to forget. And us as human beings, when we make minute changes into a data file and we don't write them down, we're going to forget why we did those changes in the first place. So always use a data dictionary, treat it as a diary to keep track of all the changes that you end up making. As you go through this raw data file, even if it's your own data, always ask yourself these questions. Is there a data dictionary? And if there is, where is it? Who has control of it? And who's in charge of it? If you're the PI, you're ultimately responsible for these data dictionaries to make sure that they're up to date and accessible. Again, number 2 here, first row is the variable names. Reserve that first row to designate the variable names. Most statistics software programs will read that first row into the statistics program. Check the number of cases and patients. If you know as the PI or as a research associate, co-investigator, that there's only X number of patients or participants in your research project, make sure your data set matches that. If you know there's 100 patients that is on your floor and you collected data on all 100 patients, but your data set only has 75, there's a missing 25 patients that you need to account for. So make sure you always check the number of cases or patients or participants in your data set versus the ones you have access to in your clinical setting or your research setting. Also, check the number of variables. If you know your survey is 20 questions and no more, of all the questions that you have, there's a total of 20, but all of a sudden you see that there's 21 columns, you need to start figuring out why is there an extra column? And if it's not in your data dictionary or your data diary, then something needs to be corrected. And also, once you get your raw data file here, look for missing data. You'll see that there's blanks here. Do those blanks make sense? If there's too many blanks, figure out why there's too many blanks. You got to take a deep dive into your data and explore why there's these blanks or why there's missing data. Maybe there's supposed to be missing data, and that's okay. Make a note of it in your data dictionary or data diary so that your research assistants and co-investigators will know that you've investigated this and provide reasons why. Okay, we'll keep going here. So you'll see here I put some numbers into the slide that correspond to these elements here. So make sure that it is one, that if it's a raw data file, that there's a data dictionary. First row of your data, the first row should be your variable names. Check the number of patients, cases, or participants simply by scrolling all the way down. If you know there's 100 patients, then there should be 100 rows of data. And then 4, check the number of variables. Just scroll to the right. If there's 20 variables, but you all of a sudden see that there are 21 in your data set, there's an extra variable in there. You have to figure out why there's an extra variable. And of course, number 5, why is there missing data? Sometimes missing data is expected, but sometimes it's not expected. When it's not expected and it's a surprise, you have to figure out why there's missing data and then deal with how do you fix the missing data. All right, so from this point moving forward, what's going to happen is I'm going to switch to the SPSS program. I provided screenshots for the remainder of the slide deck here, so you can backtrack once we make the slide deck available on our Aspire website. You can download the PowerPoint presentation slides and then follow these screenshots of all the things that we're going to be talking about today. So you'll note here that I'm providing you with univariable analysis slides. I'm providing you with bivariable analysis slides, as well as multivariable analysis slides here. So you can always backtrack and follow these directions again. So I'm going to go ahead and switch presentations, and I'm going to share the screen. I'm going to share the screen with SPSS. Well, actually, I'll share the screen here with my Excel spreadsheet. Let me go ahead and share my Excel spreadsheet here. Here's the Excel spreadsheet of my data. I want to show you this first. This is the raw data of an e-cigarette study that I conducted back in 2015, when e-cigarettes and vapes were now being and they were continually being investigated by the FDA at that time. So there was a lot of literature now being produced and published about e-cigarettes, what we knew about e-cigarettes. From a medical education standpoint, I was working at Loma Linda University at the time. I'd been there for around 12 years. And part of the curricular elements of the health professions program that I was teaching in, we wanted to know how much e-cigarette content should we integrate into our curriculum, because it was so new at that time in 2015 about what practitioners knew about e-cigarettes, what practitioners knew about their patients being exposed to e-cigarettes or vapes, and how much patients as well as practitioners knew about e-cigarettes and their potential dangerous effects on health. So we use this survey as an opportunity to see what's out there in terms of pharmacy and medical education, and how much of these results can contribute to allowing us to make decisions of how much content can be covered about e-cigarettes in our curriculum at the time. So you'll see here in terms of the raw data set, my first row here, you'll note that these are all my variable names, just like I showed you on that PowerPoint slide. ID, Q2, Q3, Q4, and every column are all of my participants, starting from the top, going all the way down to the bottom, all of my participants' responses for each one of those individual variables. What I want you to take away from this demonstration is that please stick with this organization of your data sets. First row is your variable names. That first row for most statistics programs will be read into the statistics program to identify the variable names. And every row after that will be the respective participants' responses for every one of those particular variables. You'll note here, by scrolling all the way down, my sample size is 52 participants. And if I scroll to the right, I go all the way to column AF with question 26. This was a 26-item survey, If I saw another column here with no title, no variable name, that would be possibly an extra variable. It could be a Q27 that I wasn't aware of. Then I would have to do some private investigator work here to figure out where that extra variable came from. But I know that my survey had 26 different elements. And I also know that there were 52 participants in this survey. Okay, so that's my raw data set. It'll be read into SPSS. And I'm just going to go ahead and jump into SPSS right now so you can see some of the programming there. All right, so this is the actual SPSS file. And as you'll make a note here, I'll be a little bit more efficient because I know time is ticking and we only have about maybe under 30 minutes left, but we'll be definitely going over the 3 different stages of data analysis here. But what you'll notice here is that this is the data dictionary page. It's called the variable view on the bottom left-hand screen. You'll note that where my cursor is. This is known as the variable view. There's also a tab here for data view. We click on that. This looks almost exactly like the Excel spreadsheet from our raw data file. And the way SPSS works is that once we read in our data and open our data in SPSS, it simply reads in that very first row from our raw file as our variable names at the top. And row 1 represents our first participant, row 2 represents our second participant, and so on. So you'll see it nicely read in our data, exactly how it's read in from the Excel spreadsheet using that type of formatting. That's our data view. Very much looks like and feels like an Excel spreadsheet. Our variable view for SPSS, this is our data dictionary. And what you'll notice here is that you'll have our name of our variables here as they appear in the data set. We also have our labels of our data here that matches what our variable names are on the far left column. So Q2 is actually our question for gender identification. Age, our age variable, is simply named age, and it's age in years as described here. This is supposed to be age groups. We also group them, group the age groups in terms of separate categories of age. Practice setting, whether it's a hospital, these were healthcare practitioners, primarily pharmacists, and clinical pharmacists and academic pharmacists. Their practice setting, whether it was a hospital, a clinic, community clinic, or an academic setting. Descriptive opportunity for those participants to describe. If it was a unique practice setting, they can describe it here with text, and so on. You'll note here also the different questions, question 5, 6, 7, 8, etc., that we gave them actual labels of what the questions were asking for. Years as a licensed professional, have they ever heard of e-cigarettes? It's a yes/no response as indicated by the values of what those responses for those respective questions can be. This one was a binary response of yes or no. What were the source of e-cig info? Was it from a patient? Ads or advertisements? These were just the numbers and frequencies, opportunities to calculate numbers and frequencies of the different types of sources of information that people received information about e-cigarettes. We got to these questions, 8, 9, 10, 11, and 12. You can see the respective questions that were asked of these participants. Had a patient that used e-cigarettes, had a patient that inquired about e-cigarettes, were they familiar with health risks associated with e-cigarettes, and so on and so forth. So you can see with this data dictionary embedded into the SPSS program, makes it very easy to make corrections and to make adjustments and make edits. I would still write down on a Word document any procedural changes or definitions or special reasons why we changed names or why we changed or recoded variables. I would keep that in a data diary in a regular Microsoft Word document and save that for my research co-investigators or my research assistants. All right, first things first, you'll notice on SPSS that we have a lot of drop-down menus here. Everything from an edit drop-down menu, a view drop-down menu. We're not going to really talk about those. You can always ask me what those will do later. But what I want you to take note of now is that on SPSS, this analyze drop-down menu is your most important drop-down menu. Every function on SPSS that deals with analysis will be found on this analyze drop-down menu. When you click it, you'll notice here that there are multiple types of statistical techniques that you have access to. Meta-analyses for systematic reviews, report generation for case summaries. You'll be using descriptive statistics a lot, especially in this univariable analysis step 1 that we typically will conduct. You can calculate frequencies, just more descriptive statistics like mean, median, and modes for continuous level variables. You have the opportunity for population descriptive statistics. You can even do chi-square analysis for the bivariable analysis here using the crosstabs functionality here. You can generate graphics, like graphics to test normality, like QQ plots. And you can even have this new function on this version of SPSS, the chi-square functionality. But we'll stick with our bivariable analysis using the crosstabs functionality here. To get things off started nicely, let's do our univariable analysis to figure out what's going on with our data set here. Let's calculate some very quick descriptive statistics. What we'll do is we'll click Analyze. We'll click Descriptives here. And with descriptives, I'm going to go ahead and pick either frequencies or descriptives. I'll just pick frequencies here. So we can now calculate some frequencies of some of these categorical variables. You'll notice once I click frequencies, this window pops up. And in this window, it's very user-friendly. It's really point and click. I want to know simple frequencies on some of these variables. I'm just going to pick one of them now for the sake of time. I'm going to pick gender. I want to know the frequencies of the gender identifications that are available from this data set that our respondents provided. I'm going to click and highlight gender. I'll press this right arrow to shove the gender variable into the variables box. Now I've selected gender as the variable I want to analyze. I have these options on the right-hand side of this window, and most windows that you select for the functionalities on SPSS will have these extra tabs to click on. Here I can click the different statistics that I want to produce. I have a choice. But since I know that the gender variable is typically categorical, I probably don't want to calculate mean, medians, and modes there because they're categorical. Mean gender doesn't really mean a definition. What it means is it's an average. An average number of those numbers is not going to give us a lot of information. I would probably use it on a measured variable. We could even create charts. For this one, I'm going to select bar charts here. And I'm not going to worry about format style and bootstrapping. That's for more sophisticated and complex analyses. If you want to use these, please ask me after the session. Email me, and I'll definitely provide you with that guidance. But let's work with statistics and charts. Once we figure out what options we want, we can click OK. And in milliseconds, we can produce immediate results of that particular variable. In SPSS, we're given the valid number of participants that provided the information, which was 52, our sample size. You'll note here that the number of males was that identified as male was 25. Number of females that were identified as those participants that identified as females was 27. It gives us a percentage. A raw percent of 48.1 for males, 51.9 for females. A valid percent simply reflects those excluding missing values, but in this data set, there were no missing values for this variable, so those percentages match. Cumulative percent, obviously, 48.1 plus 51.9 gives us a cumulative percentage of 48, 1, and 100. Here's our bar chart that we opted to generate. So roughly, just by visual inspection, there's close numbers between males and females in this data set. We can report these in a poster. We could report this either image by way of an image or by way of textual format by writing it into our text. But you can see now that in milliseconds, we can get some very good demographic information about any of these particular variables. Now, how do I get back to our data set here? We simply go here to our window, get back to our data set here. Well, Elvin, how do we analyze those variables that require calculations of averages and means? Well, let's go find a variable like age. We recorded the number of years for age. We can go back to Analyze, go back to Descriptives, and then pick our Descriptives tabs again. I'm going to go ahead and pick age here. You'll notice there's a little ruler telling us this is a measurable variable, a continuous level variable. I highlighted that. I'll click the right arrow. It puts it into the variables box, knowing that we now selected it. When I click this descriptives window or click into this descriptives window, notice the options have changed. It'll automatically calculate the mean, median, and mode and measures the central tendency using the descriptives window. When I hit OK, you'll note here in this little box, let me make sure I can show you. Yeah, the slide did not move. Thank you, Devinder. Let me go ahead and show you what this, what the results look like. I apologize. I always think that our share screen will get to our output here. So let me show you the output. So here's the output. Here's our gender variable here. My apologies for not showing you this earlier. Here's our gender variable. Males, females, 25 and 27 respectively. Here's their respective percentages for this categorical variable. For our descriptive calculations for a measured variable like age, in years, there are 52 as our sample size here. 25 was our lowest age. Our maximum age was 66. Our mean age, therefore, was 38.85 years. Our standard deviation was 10.25. So our average age is around 38, 39 years old. Pretty wide dispersion in terms of our standard deviation here. But again, we only have 52 participants from this sample. Okay. What's really nice about SPSS is that you still have all of your functionality here on your drop-down menus. So you can calculate all of your calculations in the output window. So we don't have to go back to the database unless there's a reason why you need to go double check your variables. Let's do another practice here. We'll go back to descriptives. We'll get back into frequencies. Let's do another analysis here. Let's look at practice setting. Where are all these participants who filled out this survey? Where do they practice? This practice setting here, you can see it's categorical variable by the icon with the 3 different colors. It means it's a nominal variable. That's what this little icon means. Let's look at charts again. We'll stick with using bar charts here. We know that it's categorical because practice setting is a categorical variable. We'll hit OK. 52 participants. You'll note here, community pharmacy, hospital pharmacy, managed care pharmacy, ambulatory care pharmacy, academia, and we coded this as a 6 because it was an other or unknown. So in our data dictionary, we'll note this as an other. We just coded it as a 6 or an unknown. Wasn't well described. But there were 17 community pharmacy practitioners, 25 hospital pharmacy practitioners, 2 managed care pharmacy practitioners, 3 AmCare, 3 academia, and 2 that were other. Here's their respective percentages. Their valid percents, excluding the missing value or the missing values. And here's the cumulative percent to lead up to 100, which was our indicating all 52 participants responded in some way. Here's our bar chart. Most of our sample participants worked in a hospital pharmacy. Second most was a community pharmacy, and then the diverse categories here, managed care, AmCare, and academia, and other were listed here. So primarily hospital pharmacy and community pharmacies where most of these individuals were working in terms of providing us responses for this particular survey. Let's say that we've conducted our univariable analysis, and I always recommend for all of your variables, run a univariable analysis on all of your variables, just so you know where they're at relative to some basic statistics and to get a demographic profile. But for the sake of time, we'll only run these 3. Let's run into next our bivariable analysis. For a bivariable analysis, again, we're going to go here to our Analyze drop-down menu. And with this drop-down menu, we can find almost any statistical analysis technique that we can. But for a bivariable analysis, we'll do 2. We'll do a chi-square analysis first. We'll do a chi-square analysis first. And what we'll do is we'll go to descriptives. And we'll run down here to our cross-tabulation or our cross-tab function here. When we click that, another window will pop up. And in this window, what you'll notice is that there's an opportunity for a cross-tabulation to pick a variable to represent the rows of the cross-tabulation table, and click another variable, choose another variable that will become the columns of that cross-tabulation table. As you all probably know what cross-tabulation tables are, they're called 2x2 tables, or 2x3, 2x4, 2x5, depending on how many categories each variable has. So let's just practice here. We'll do practice setting as one of our variables. We'll make that the rows. And then I want to know, in those different practice settings, what types of patients did those practitioners come in contact with that used e-cigarettes? So I'm going to look for that variable, which is our number 11 variable. Which is right here. They had a patient that used an e-cigarette, we'll put that as the columns. What's nice about this cross-tabulation function is that we can pick our statistics that we'd like to calculate. And because it's a cross-tabulation, customarily we'd like to conduct chi-square analysis. And because our sample size is greater than 30, we don't necessarily have to conduct a Cochran-Mantel-Hansel. That's reserved for very small sample sizes, like 30 or less. But chi-square is generally used for, very nicely used as a non-parametric test, but can be used for samples that are greater than 30. And in my cells, I not only want the counts, the numbers, but I also can calculate row percentages, column percentages, and total percentages for my columns and my rows. Once I select those options that are appropriate, I can hit OK. And what you'll notice here, had a patient that used e-cigarettes. This is where we find out if we have some miscodings here. This is supposed to be a binary response as yes or no, but it was coded strongly agree and agree. It doesn't make sense. So guess what we have to do as we're fixing our data as part of our data management plan? We have to go into our data dictionary and fix this coding. Make this a yes and this column a no. Yes, I did do this on purpose, so you'll see that as we do our analysis, sometimes things don't make sense. And we have to go back to our data dictionary and our coding to make sure that things got coded correctly. And if they're not, we have to change the coding. The numbers are most likely correct, but now the labels are wrong. You'll notice on this side for practice setting, community pharmacy, hospital pharmacy, managed care pharmacy, ambulatory care pharmacy, academia, and 6 for other. These are the respective counts, 10 and 7, 10 and 15, 0 and 2, 1 and 2, 1 and 2, and then 0 and 2 here. You'll note that the SPSS also calculates the respective percentages within the columns, within the rows, and then total for each individual box, each individual cell. So you just have to keep track of which percentages reflect what count. So this 58.8 within the row plus 41.2 within the row should equal 100. This 45.5 and this 23.3 within the columns should equal 100 within the columns. That's how you'll decipher what those percentages mean. And then the third one here, of the total 19.2 and 13.5, all the individual cells here should equal 100% for the total. Excellent way. You don't have to use a calculator. You can simply ask SPSS to calculate these figures for you. Another bivariable technique I want to show you real quick. This is the chi-square analysis. Here's the other one real quick. Here's the Pearson chi-square statistic, 5.086. It tells us whether or not our expected values of the practice setting cell numbers here are within expected values compared to if they had a patient that used e-cigarettes or not. It's telling us that these numbers in each of these cells, there's no difference. There's no difference in the cell numbers compared to their expected cell numbers with this chi-square value of 5.086. Here's our p-value. 0.406. It's not statistically significant. Another bivariable analysis that we can use. We can go again here for a correlation, comparing one variable to another variable. You click Analyze, scroll all the way down here to Correlate, and bivariate or bivariable analysis here. We click that, another window will pop up. And now we can simply select the two variables that we want to compare, or multiple variables that we want to compare in a pairwise fashion. And in this case, we'll just keep it simple. I'll select gender. I want to see if there's a relationship or an association between gender and ever used cigarettes, which is question 9. We just scroll down here. Ever used cigarettes, question 9. I want to know if these two variables are associated with one another. There's really no options here that we should be looking at. I'm just going to go ahead and find the correlation between gender and ever used an e-cigarette. Because I have more than 30 participants, I can use a Pearson correlation. If I had under 30 participants, I would probably use a Spearman correlation here. I definitely want my p-value to be two-tailed, so it's defaulted as a two-tailed p-value. I can click OK. And what's beautiful here is that now I have my two variables being correlated with one another. And what they'll do is what SPSS will do is it'll correlate each variable with itself as well as the other variables. So gender, you'll see correlated with gender. That's a perfect correlation, obviously, because it's correlated with itself. But here's gender correlated with ever used e-cigs. This number, 0.336, is the correlation number. That's the correlation number. The row, the Greek letter rho, 0.336. Very, in my opinion, the commonly accepted norm guideline for what is considered a stronger correlation is any correlation absolute value of 0.6 or higher. This one's 0.336, so it's not a strong positive correlation. It's indicating there is a positive correlation here. Here's our p-value, 0.016. So this is a statistically significant positive correlation, but it's not a strong one. What's nice about the output here is that they also give you a heat index. Really green here, this color green on this index, indicates a highly positive correlation, which they also tell you in SPSS there is none based on the numerical value. Here's this color, this slightly faded teal, which we have here. Positive correlation. Gender is positively correlated, but not too strongly correlated with ever used e-cigs. And here's the other color codings that could be possible as well. How well can you say SPSS is giving you ways to interpret these data? It's doing a nice job, I think. Now that we're running out of time, I'll do a multivariate analysis here. And multivariate analysis, we'll stick with an independent samples t-test simply because we have a sample greater than 30. There's a sample here of 52 participants. So we can use an independent samples t-test. We're going to compare two groups. And the groups that we're going to compare is going to be based on gender. Do males and those identifying as females, do those two groups differ in their ages? Very simple question. Do those two groups differ relative to their age? So we're going to go back up here to the Analyze drop-down menu. We're going to scroll down to this function, Compare Means and Proportions. Here's our parametric test for comparing two groups that are different from one another, independent samples t-test. When we click that function, the independent samples t-test window pops up. And now we can use our test variables. In this case, the test variable is the variable we want to compare between two groups. And in this case, it's going to be age. It's a measured variable. So we'll select that and put it into that window. The grouping variable is the variable representing the groups, the two groups that we want to compare. In this case, it's the gender variable. We'll go ahead and put that variable in here. Notice that we have to define the two groups we're comparing. Notice that there are two question marks here. It's because SPSS doesn't know which two groups that we want to compare. We simply designate those two groups. We've coded this variable beforehand, so we did this on purpose. Group 1 were those that we coded as male. Group 2 are those that we coded of participants who identified as female. Once we select those are the correct codings, notice that 1 and 2 replace the question marks. There really are no options that we should be selecting at this point because SPSS will default into the appropriate t-statistic and p-value here. When we click OK, in milliseconds, SPSS will produce our results. It'll give us this box here, how many males and females of those participants that identified in those respective groups. This mirrors the results we saw beforehand. The next box is our independent samples t-test results. You'll notice here equal variance is assumed and equal variance is not assumed. As a biostatistician, we probably would recommend to you to use this equal variance is assumed simply because our sample size is large enough. It's greater than 30. Here's our t-statistic, 0.318. Our two-sided p-value. We also have a calculated one-sided, but let's go with our two-sided p-value to be more conservative. It's 0.752. Here's our mean difference of 0.913. Standard error is reported as 2.871. And here's our 95% confidence interval. Notice here that our t-statistic is rather small. And our two-sided p-value is 0.752. It's telling us that the average age between males, which is 39.32, is statistically similar to the average age of females of 38.41. Which means our ages between these two different groups are statistically similar. They're not widely different. If they were widely different, we would see a p-value here that was definitely less than 0.05. You'll notice here our independent samples effect sizes. Some journals would like you to report effect sizes based on some of the calculations that you've produced. These would be the effect sizes using Cohen's d, Hedges correction, or even Glass's delta. I'd probably report and recommend to you to report Cohen's d for these particular effect sizes. And you can see here the effect size, the point estimate is rather small, 0.088, but that would make sense because the difference between these two averages, it's very, very statistically, even visually inspecting it, the differences between these two averages is very small. We're coming in at the end of the hour. Are there any questions from the group? Looking at the chat, no questions from the group. And as you can see here, just wanted to show you that these results are listed in very nice visual format. I think that SPSS does a nice job of organizing our results very well in a nice tabular format and very nice graphical format. Statistical programs like R, like SAS, it doesn't look this nice. It basically looks like numbers on a page. So visually, you just have to do a little bit more, I guess, beautification of those graphics and those results. But SPSS does a nice job of formally reorganizing in a way that's visually appealing. Are there any questions? All right. If there's no other questions, thank you so much for coming today. If you have questions later on or you're getting into your data analysis and you'd like to learn more about SPSS, please, please, please see us. I just want to show you make a plug for one of our other offerings that we have for our Aspire group. You'll note down here, the last slide, we do have our data analysis lab that's offered every Thursday, 1 to 3 p.m. for in-person, and then 3 p.m. to 5 p.m. on those Thursdays for virtual. But you can make an appointment with myself or Mr. Hoke at any time during the week if you have any of these data and analytic questions. Thank you so much, everyone. We'll look forward to our workshop 11, which will be how to construct an abstract, writing an abstract for publication, either for poster or manuscript or even oral presentation. That'll be held on April the 26th next month, April 28th next month at the end of the month. That'll be presented by Mr. Hoke. Thank you so much, everyone. Hope to talk to you all soon.